Thank you guys for being here early with us. Welcome in. Hey, everybody, it's Thursday night, and we're so excited to see all of you again. I know that a lot of you are just hopping on the Zoom, but I just wanted to let you know a couple announcements before we hand over the floor to my co-hostess with the mostest, Michelle, that we are going to be, this is our last session together, but we are going to end it with a bang. And I'm very, very excited because first Michelle's going to kick us off just to get the energy flowing with one of her games, and then kind of to review. And then she's going to kick it back over to me. I'm going to do a little bit on basic 12 lead, and then we're going to spend most of our time in the breakouts with you going over actual EKGs like we did before. So if you're not on Zoom, go ahead and hop on Zoom, because this will be one of the nights where we definitely want to get you into the Zoom session, so that because you can't see the recording of the Zoom session, we really want to make sure you're there. Also, tonight's night, we're going to be announcing our scholarship winner. So we will be doing that at the end of tonight. So that's very exciting. The scholarship we're going to be giving away tonight is for the 30-day EKG challenge that starts Monday. So if you've been loving this class, you will absolutely love that class, but I'll talk more about that later. And yeah, let's go ahead and turn the floor over to Michelle. So Michelle, they're all yours.
Hey guys, how are you? Are we live on Facebook yet?
We are.
Okay. Yes. All right. I haven't started tagging people yet. All right. Hey guys, it's so exciting. I love game night, and this is so much fun to play games with y'all. So I'm going to go ahead and start because we just have a couple minutes before Jen gets on. So I'm going to put my game on for you, and I love to play games. So, oops, and I've already messed it up. Started at the very beginning. Let's go back to the beginning. Let me start it back over again because I want to start it at the very beginning. There, that should work. Play from start. Oh. Okay, we'll get this right here in a second.
Oh my gosh, so cute. Look at baby Yoda.
I am sorry. He doesn't want to start where I want him to.
Oh no.
He will. He will.
Okay.
Yeah, I get it back to the very beginning. I just want to make sure it starts from the very beginning. That's what I want it to do. He doesn't want to do that. We'll just do it this way.
I love that sound. It's so cute.
Okay, there we go. That's what I wanted to do, was to start at the very beginning. All right, so here, this is what I want to do. And this is just a cute little game to play. So the first question is, this is our basic EKG. And the sinus node, as Jennifer talked about a couple times, creates what? The sinus node creates what? And it's usually upright in most leads, except one particular lead and V1. That's when the sinus node is in a different one. So type in the chat, there's my chat. Type in the chat the answer that you're seeing. Jen, can you see the chat? Because it's not wanting to show up real well for me. Okay, I've got a couple people. Yeah, I can see it now. Okay, I can see a couple. I'm just trying to get it over to the side so I can see the thing. So P wave and AVR, y'all are so smart. Yeah. So P wave and AVR are where the sinus node P wave is upright in lead 2, and that's how you can usually tell that it's sinus. And that's a little trick that David always tells us, that if you're not sure if it's a sinus P or not, look in lead 2. If it's upright and it's inverted in AVR, you're pretty much guaranteed that it is a sinus rhythm. Okay. That's a lot of. The only thing about the game is when I have everybody's heads in there, it's hard for me to figure out where the game thing is. I'm sorry about that. Okay, there we go. Now I can get to my little thing. All right, so second question. I'm concerned about these intervals. Oh no, what do I do? Look at those intervals, especially PRI, your PR interval. What do you think about that? Is it normal? what is the normal for the PRI? What is normal for the for PRI? And I still can't see us on Facebook yet, Jen. Are people answering on there? Because I'm
They
not.
are. Yep.
Okay.
I'll tag you so you can see it.
Okay. For some reason, not wanting to come up. Sometimes it takes a little bit. Okay. So I am going to go ahead and get that answer until it pops up here. All right, so yes, 120 to 200 milliseconds, or sometimes you'll also hear, and I'm old school, so I'll still in my brain have to translate that. I say 0.12 to 0.20. So if you're writing that, that's exactly right. That's in seconds and 120 to 200 milliseconds. I'm just not as quick on the switching it over all the time in my head. So that is correct, 120 to 200 milliseconds. So third question, the QRS complex, what does it represent as a mechanical action in the heart? And I'm real specific about this because of working with ventricular assist devices. We always separate out the native heart, the electricity of the native heart, and the mechanical action of the native heart. And I always have my little squishy heart here. And I talk about the electricity that goes through and then the mechanical action that happens. So when that EKG has a QRS on paper, what does it show up on? What is happening in the native heart? What is the native heart doing? And everybody's answering, yes, ventricular depolarization, yes. So that's when the heart is depolarizing. That's when the ventricles are squeezing and hopefully squeezing together, right? That's what you would want. And then just as a side, as that's ventricular contraction, the T wave then is ventricular relaxation. So that is when the ventricles are relaxing, and that's always really important because that's when diastole starts. And again, diastole is super important. Diastole is always super important because it means the coronary arteries are getting oxygen. Diastole is when the coronary arteries get oxygen. Let me see if this one works. I'm not sure if this will or not because it's going to go to a little quick simulator. And if you watched Gary's last night, he is way much better than this one. But I'm just going to see if this one will work. I have to stop the share and start another little quick share. And hopefully this will work. Tell me if you can see that on there. It's a quick little free little game that was on the internet that I found. And I just wanted to see if y'all would like it. And we can just play one little quick game here and tell me what rhythm that you think that is. I have no clue when this pops up. It just pops up. They're just quick little games. It's a free little one that I found while Gary's still working on his new ones that are coming out. So what do you think about that? And now I have lost my chat again. There it is. Okay. There we go. Yes, probably second degree, most likely. Well, you know what? I am watching those little P waves and the QRSs are pretty consistent. So either second degree or third degree.
Right.
Yes. So I had third degree and I had a couple other people say complete heart block. You'll hear it called complete heart block or third degree. Usually the key to the difference between second degree and third degree is third degree, there's no dropped QRSs. There's no dropped QRSs. So I wanted to see if that would work. That was a little changeover. So we got that right. Yay. So that did work. I haven't done that one before. So y'all are the first ones to have that done. Okay, so it's just 4 more questions. This was a 65-year-old male came in complaining of palpitations since a couple hours, 3 hours. What are you thinking? What do you see on that one? What are you seeing? Yes, flutter, lots of flutter. Yes, lots of flutter. We should make a song out of that, Jennifer. Like a flutter song. We could do that. We could do in adding to games, we could have like a song and dance with it too.
Oh my God. Nobody wants to see me dance. You can do the dancing.
No, are you sure? I think it would be fun. Okay. Just so that we're talking a little bit more about blocks. What do you think about this one? This guy's a 50-year-old male, 58-year-old male, and he's not feeling very well. What do you think about that? It's a block. What kind of block do you think that might be? What kind of block do you think that might be? I use the thought process in my head that if there's missing QRSs, it's either first degree. It's not first degree and it's not third degree. If there's missing QRSs, it's not first degree and it's not third degree usually. It's usually second degree. And then you got to figure out, is it second degree type 1, second degree type 2? If the PR intervals are always the same, it's second degree type 2. If the PR intervals are changing, it's second degree type 1. Does that make sense? So that one's second degree type 2, because I've got missing QRSs, but if you look at those PR intervals, they're always the same. They're always the same. And I actually had one other, let's see if it'll pop up. Yeah, I had one other example of it, and I highlighted it in. It's a 12 lead EKG, but I highlighted lead 2 down here at the bottom so that you could see. If you pull back and you look at that and you see there's missing QRSs, then throw out first degree, throw out third degree, hone in on second degree. It's a second degree, and it's either type 1 or type 2. If it's type 2, the PR intervals are always the same. Or you could say it the other way. If the PR intervals are always the same, it's type 2. If the PR intervals are always changing, it's type 1. That's how I have it in my head. And it, unless the second degree is, there's some particular second degrees that every once in a while they do change a little bit. You might get into that, but that's kind of the big picture review of that. Okay, so let's do the next one. Okay, before I forget, I don't want to forget tonight, we have mug rugs that I want to give away too. So we're going to do some hashtag things for that. All right, so we've got like 3 more minutes here. We've got 3 EKGs. So what do you think about that? My little zebra guys are actually looking at some ST elevation in 2 leads. And we like to call those leads sister leads, but there is a professional word. And what is that professional word? That's not sister leads. Oh, Kathy, yeah, you could see that better. Type 2, yeah, that one was a better example. I wanted to have a couple different examples, so it would be a little bit better. And what do you think about this? What do we call that? I think we've already talked about it, or maybe we might be talking about it tonight. So we may be talking about it tonight. Yes, leads that are fed by the same artery. So we're going to call those contiguous leads. That's our fancy word. And because these are in the lateral wall, this is in the lateral wall, we'll get to that tonight, but we're going to call those contiguous. So they're looking at the same area of the heart and they're fed by the same artery. They're fed by the same artery and they're sisters. I love it. Okay. 2 more. This one's super fast. What do you think that rhythm is? What is that rhythm? Contiguous. I can't spell. Yeah, me either. I actually write it out and then I let it spell check it. Yes. AFib. AFib. I have lots of AFibs. Yes. Contiguous. Danielle's got to. Now, Daniela spelled contiguous right. I seriously had to spell check that one. I don't know why that one's so hard for me. Yes. AFib. Perfect. Okay. And our last little one. And then I will run you off to Jen. Thank you for playing with me. What? Come on. Come on. Show up. There we go. Okay. What are you worried about? What are you worried about? And what would you do with this? It starts off with one particular rhythm. I love that, Joanne. She's worried about death. Yes, for sure. I love it. She has my sense of humor. That's pretty wow. Yes. So we've got a ventricular tachycardia going into a ventricular fibrillation, VTAC to VFib. Yes. And somebody said, Carmen said, where's the life pack? actually, the life pack is on this page on the answer. I found a little life pack. So it was actually in there. So that is it. Our little G, our zebras are going across. Come on, zebras, move across there. Oh, they're not wanting to move across today. They were moving across. Anyway,
those stubborn zebras.
I know. I don't know what's going on with them today. All right. That's my little game. Exactly 10 minutes.
Thank you, Michelle. That was so fun. Yeah, type in the chat what you think of Michelle's game, because if you like it, we'll bring it back. So let us know if that was something you guys want to do again. We can absolutely bring it back. Yeah, cool. You're getting a lot of cool. So that was fun. I agree. Yes.
And that's a new one. No one has seen that one before. I built that one today, so it's all brand new.
Thank you, Michelle. You always make this so fun for us. We appreciate you. You got some clapping too on Facebook, so you should check that out. Okay, so yes, keep the game. Okay, I mean, how can we ever argue with the masses? That if you say you want it to stay, it stays, right? Okay, so we're going to go on to a little bit of the learning portion of tonight before we go into the breakout. So if you are on Zoom or Facebook, try to join us on Zoom. I think we posted the Zoom link. I just posted it again in the feed. So if you guys want to jump on, we have unlimited access now to our Zoom. I think we were limited the first night, which is why some of you didn't get on, but we made sure that won't happen for tonight. So anyway, we're going to do 12 lead stuff tonight. So this is where we start to dive a little bit deeper, but I just want to make sure that you guys know we're trying to keep this kindergarten level as much as possible. But in the groups, we will go a little bit higher in the sky, so to speak, because we do want to get your feet a little bit wet. Also, let me know in the chat on Facebook or Zoom, because tonight is our last night that we are supposed to spend together. But if you want me to come on and do a special bonus session on Sunday evening, I can come on and do a special bonus session. And we can do practice 12 leads where we go over the 10-step system. So we're just going to introduce you to it tonight. We don't have time to actually go through all of the 10 steps on the EKGs because that would take a long time. But we can go over it on a bonus session. So let me know in the chat if you want to do that. Oh, hey, Suzuki is here. So yeah, if you guys, enough of you say yes, we'll go ahead and put that session on. So that will be most likely Sunday evening. Cool. Okay, I think we're Snarfly. Interesting name, by the way. Love it. And more. Love that. Okay, so let's kicked off with our session of the night. Now, of course, as I mentioned earlier, we are going to be giving away the scholarship tonight. That's going to be at the end of our class. And that is going to be a giveaway for our 30-day 30 EKG course that starts on Monday. So basically in that course, if you win this, and one person's going to win tonight, if you win access, obviously I'm going to show you all the things at the end, but if you don't win access, you can absolutely get your ticket and still join us, where if you like Michelle's style and my style of teaching, we mostly do all the classes in this course, and you can join us there. But I'll tell you about the scholarship winner at the end. But what we were looking for was people who were being helpful to other students. And so there was one particular person that stood out this round who was helping pretty much nonstop the other students. And we really liked their chutzpah, so to speak. So I'll tell you more about that at the end. This is my dad, by the way. He passed last year. So this scholarship is not given away lightly, just to let you guys know. Okay. So one thing that I wanted to mention before we kick off is that there's a couple of things that are happening in the world right now in EKG land. We did a talk on this, I think about 3 weeks ago. We talked about the new landscape, where I'll talk about this a little bit more, but we were really focused for a long time on STEMI recognition, and our landscape's changing a little bit to where we're needing to identify different things. And I don't want to go too heavy on this tonight because we're supposed to stay in kindergarten, right? Keep this very basic. So I'm trying to do that, but just know that the machine software is not accurate. And that's the article at the bottom if you want to look that up, but it will steer you wrong a lot of the time. So I put a sushi roll on here because normally David White, our Mandalorian, he normally pops on and he says he trusts the EKG software as much as he trusts gas station sushi, which is not a lot. So what does that mean for you? If you're a provider that uses the software interpretation as your read, that's not accurate, and you can get into big trouble. So as much as it's hard, we really actually have to know the interpretation ourselves, because if the machine is not going to get it right, and if we don't know it, where does that leave the patient, right? So that leaves us wide open to risk, and that leaves our patient wide open to have harm, which we don't want either thing, right? At the end of the day, it's about our patients going home safe and us going home keeping our licenses if you're a licensed provider, okay? So know that the machine usually gets it right the closer it is to normal. So it usually will calculate your intervals correctly. And if it's close to normal sinus or normal EKG, it will usually get it right. I'm going to show you an example of an EKG where it did not get it right. Okay, treat your patient, not your equipment. Exactly. Okay, so Remy, hopefully you guys have been seeing Remy in the pre-show that we've been showing, where Remy has been weighing in on some of your comments. But basically, he says tonight, his big message to take home is to know what normal is so you know what abnormal is. So a couple notes, we've already covered this. We covered that the T waves, they need to be all upright except for the two leads, AVR and V1, which Michelle had in her quiz, which was great. And that we're looking for basically a very clean EKG, no artifact. We're looking for normal intervals. So the numbers at the top of the EKG fit in all our parameters, okay? And we'll go over those again just to review, so we really have a solid handle on that and why they're so important and some of the clues that they can give you. We also need to make sure that our EKG has normal voltage. So we want to make sure that our QRS isn't too small and it isn't too tall. There's a lot of criteria, so to speak, for LVH, left ventricular hypertrophy, that you can look up and review. But just a side note about that, LVH, a lot of people get really hung up on LVH and they want to learn all these math criteria for it. But at the end of the day, I just want to know if this really makes a big difference in the clinical setting for you in that acute visit. And I would say that for me, I don't think it's worth spending the time doing the math of an LVH patient because, and I'll just deep dive on that for a second. If a patient has LVH, what do you do with that clinical information? Well, the worst case scenario, you would be concerned about someone having a hypertrophic obstructive cardiomyopathy. That would be life-threatening potentially, right? But other than that, maybe it's some uncontrolled high blood pressure, or maybe it's potentially some heart failure. And yes, pre-hospital can't treat that exactly. So even in urgent or primary or ER, wherever we are, LVH doesn't really do us a whole lot of good, except for, like, let's say you have a shortness of breath patient and they have a big potential ventricle, okay? That might steer you down the CHF road versus the COPD road. And that's would be true in even pre-hospital setting, KJ, right? So it's sometimes helpful, but it's not really enough benefit to spend and obsess about it, okay? So what I think is important, and just kind of to reshift how we think about EKGs, what happens to us in the very beginning when we're learning this is we get stuck on the things that don't matter. And that's my big beef. I'll throw it out there. I really feel passionate that when we're teaching our baby providers, or even our providers that are doing this a while, but they never really got the good foundations, we're like, oh, here's vectors, here's the axis, here's LVH. And like, that's not really important on an everyday basis most of the time. Here's what's your high yield stuff. It's if you have minor ST elevation or potentially one of these new findings, right, that are STEMI equivalents, that's what matters. If you miss an LVH, like a little LVH, who cares? Like at the end of the day, right? I mean, we need to know it, but no one's going to potentially die from that unless it's a HOCA. But there'd be other signs that would be on the EKG or the patient, right? So there'd be other things. So axis is important, but only really for wide complex tachycardias or little details like hemiblocks. But in your everyday world, it's not enough to spend a lot of time on and obsess on. So while you're busy obsessing on the axis, you're missing the things that are more important in life, like the ST segment. So that's where you need to spend your time. So find the STEMI for the cath lab before they code. And there's also pre-STEMI indicators, KJ, that are things we need to pick up. And here's the scary part, not to scare you. I'm sorry, I'm on a rant. I can't help it, you guys. I feel really passionate about this, but here's the problem. There's things that are STEMI pre-indicators that happen before STEMI that are just read as non-specific ST2 wave changes. So if we just rely on the machine and we're like, oh, it's non-specific, it's not a STEMI, you could potentially send home a patient who's about to STEMI home. And maybe they just have indigestion, something really atypical, or maybe they're female and they're presenting with like fatigue or weakness or dyspnea or something really random, because that's what female patients usually do, right? Or diabetic females or diabetics in general, right? Like they just don't present normal. They don't read the book. So we need to rely heavily on our EKG skills. Okay, so going back to the program presentation. So voltage matters, yes. Low voltage matters the most, because if it's low voltage, it can be something serious. So we're going back to thinking worst first so that we don't get burned, right? Low voltage is always an effusion or tamponade until it's not. Now, of course, there's things that cause low voltage, like big breasts. We talk about that, big body habitus, COPD, but you don't want to miss a pericardial effusion, right? So you want to look at the whole picture. You want to really listen to your heart sounds. And you want to look at the whole patient presentation and the history. Okay. So then lastly, the family, and thank you, Tori, for always highlighting my salient points. The family is really, really important. Let's go back and talk about that for a second. So the mom is the P wave, the dad is the QRS, the baby is the T, and they all hold hands on the EKG walking along together. And what's important about that is once you realize that that's what you're actually looking at, you start to recognize patterns. And when you recognize patterns, that's when the magic happens, because the high risk things are patterns. Like we'll show you some in this presentation. One of them is something called Brugada. It's kind of a random thing, kind of a zebra, but it's a really good thing to know because it's life-threatening. Okay, so the family, if you have a P wave very far away from the QRS, you know that that's a first degree block if it's consistent, as Michelle kind of covered, and then we covered with Gary last night. And then if you have a T wave very far away from its own QRS, that is concerning for prolonged QT. So that's why our intervals matter and the family position matters. And what matters even more than that, there's so many things matter, but is the size of the baby. There is actually a pre-STEMI indicator that has to do with the size of the T wave, and that is it. Okay, so literally, like, the details matter, but knowing how to spot them by knowing what normal is really important. So let's go over the normal EKG, and here is an example of one that I was able to pick up. So you can see here that first things first, just looking at it really quick, right? Is there anything that is jumping out at you? Okay, so you have no artifact, which is A plus, right? We don't want artifact. If we have artifact, we can't really get a clean EKG. And, just to back up for a second, a lot of people are like, oh, I don't want to bug the person who did this. Oh my gosh, they're so busy. But like, if you can't see if there's AFib or not, you cannot accept that EKG. You need to go bug the person, right? Because at the end of the day, you have to be able to see if there's AFib. Your patient has AFib and they leave because you didn't want to get another EKG, they could stroke. And that would not be good. So artifact, you have to be able to see the P's. You have to also be able to see the ST segments with good certainty and clarity. So let's talk about the ST segments. This is where, when you look at an EKG, it's one of our steps, which I'll show you the list tonight. But if you said, Jen, like literally, I'm never going to see you again, ever, which don't be a stranger. But if you said, Jenna, I'm leaving your world forever, what would you tell me if you had one last thing? Well, actually, I would tell you two things. I would tell you, know the things, the high risk patterns that can kill people. I would tell you that 100%. But I would also tell you, this is where you focus your energy. And there's a segment that we haven't talked about yet. It's right here. So this segment right here, this is the TP segment. It goes from the beginning of the T to the beginning of the P. This segment right here is the most isoelectric line, which means the most flat line, which means it's the one that we line up with when we're measuring to see if there's any ST segment elevation or depression. So why is it so important that we find ST segment elevation or depression? Because elevation, even 1 millimeter, can be pertinent for STEMI in most leads. 1 millimeter, which is one small box, which is also why if you have a tool like the RCAT window, great. If you don't, get a pen and paper and actually physically do this. Because I don't know about you guys, but as I get older, my eyes are not as great as they used to be. And I don't want to trust my eyes on an ST segment, right, that might be elevated or depressed, especially if it's 1 millimeter. That's like minuscule and very easy to miss. So anyway, going over here, this is the TP. This is the TP. So what do? When you have an EKG and you're wanting to measure the ST segment, you find that and then you make your line. So I already drew a blue line all the way across to represent that. But what you want to do is you want to do it on every single lead. And once you do that, then you can say adequately if there's ST elevation or depression. I can tell you, look at this, there isn't. But when you're first learning and first practicing, it's a good idea to absolutely do this, because that way you don't miss anything. And so Michelle, so EMS stays on scene for 12 lead now instead of load and go. Yeah, because you want to get a clean EKG. It's so important to do that. And Michelle's highlighting all the salient points. I appreciate that. So going over the other things, again, your T wave is inverted in AVR and V1. Your rate is normal. And then you're going over here and you're screening all these intervals. And what you're looking for is, right, we talked about this again, but let's just go over it real quick. Okay. So Willie says QRS is too narrow. So Willie, the QRSs are never too narrow. There's not such a thing. We want them to be narrow and skinny. So skinny is good. And there's not such a thing as too skinny, actually, in QRSs, believe it or not. But looking at these P's, we want the P to be beautiful and round, no notching. It's not too big, not too small. The QRS to be upright, and then the T wave to be a little asymmetric. And we want the family to be holding hands. We want the R to R to be normal, which it is. It's a regular R to R. And going over here to the intervals, the ventricular should be 60 to 100. It is, check. PR should be 120 to 200, check. QRS should be 70, or actually less than 120, less than 3 small boxes. We talked about that, check. And the QTC is less than 460, check. And the axis, which is 51, is normal, which is check. So 0 to 90 is normal axis. So all signs are a go on this EKG that this actually is a normal EKG. The machine software got it right on this one, but doesn't always get it right on this one, on the EKG. So like, for example, here's an example of one that says this is a normal ECG. But you know what? It actually isn't. This isn't a normal ECG. There's 2 things that are not normal on this. So one of them is here. So that's why I just went over the intervals to remind you. This should be anywhere from 120 to 200. It's not. So when you have a short PR, it's not picked up here a lot of times. And if you do, you got to go look for something. And you got to go look in the beginning of your QRS. You have to go look for a delta wave, which would look like this. Okay, so it would look, the QRS would look like that versus nice and tight. This would mean they have a Wolff-Parkinson's-White accessory pathway. They don't have it in this case, but when you see that, this is one of the clues you're going to go look for. So if my patient ever has palpitations, the first thing I'm like, okay, cool, let's look at your PR. Is it too short, under 120? Cool. If it is, go look for a delta wave. If not, good, right? I'm gonna look for other things too. There's a list of 5 things, but that's the one thing I'm gonna look for. So that's what not normal. Now, the other thing that's not normal is that you actually have a, let's see, let me grab my pen. You actually have a inverted T wave over here in V2. Remember, we said inverted in AVR and V1, and that was the only places, okay? So if it's inverted somewhere else and it's actually inverted over here, that's technically not a normal EKG. So this is wrong, you're wrong. And so this is not, so don't, this is just proof, you can't trust it. So Daniel on Facebook says, is the best lead to look for a delta. So here's the thing with that. There is no best lead because it could be septal involvement for sure. There's no best lead because it depends on where the pathway is in the heart, and it can be different. So if the pathway is over, on this part of the heart versus this part, it just depends. I will tell you that usually I see it in V4, but you got to have it more than one lead. And it really does depend on where the pathway is. So there's no like one secret lead to look at it in, unfortunately. There's a lot of secret leads for other things, but that's not one of them. Okay, so let's talk about really quick. Michelle talked about contiguous leads. That kind of stumped us earlier, but let's go over those again. And let's talk about them. So you've got the 2, 3, and AVF. This is a review, right? 2, 3, and AVF are fed by the same artery, so they are contiguous leads. These are also known as the inferior leads, which is great. And you've also got, as KJ just mentioned, you've got the septal leads, which are V1 and V2. Then you've got the anterior leads, which are V3 and V4. And then you've also got 4 lateral leads, which are 1, AVL, V5, and V6. So that's kind of the breakdown, and everything that is labeled together, as Michelle calls them, are sister leads. So if you are joining us in our 30-day, we actually do this exercise with this EKG where we color code it, and we actually go over this a little bit deeper. But this is just a cursory, quick glance at what contiguous leads are. We also cover reciprocal changes. Can't get to that tonight, unfortunately, too much. We might get to it in the breakouts, but it's really important to know. So these two terms, the only time you need these two terms is in STEMI. So contiguous leads, the definition is fed by the same artery, and reciprocal changes is the opposite side. So anything that happens on the top, the opposite happens on the bottom, and vice versa. So always remembering that, but the only time you need that, well, back up. You need these two terms for STEMI, but you also need contiguous leads if you have Q waves. So it's really important to understand the anatomy of the heart too, and what artery feeds what, because it matters with Q waves. If you're going to say, oh, this patient's got Q waves and they've got chest pain, they need to go to the hospital. If you have a Q wave in 3 and then over in V6, they're not contiguous. So the hospital is going to look at you funny, right? So you have to understand the basic foundations of the anatomy as well. So let me share with you my 10-step system, how I look at a 12 lead, and this is how I stay safe. Now, you don't have to use this system if you already have one, but if you want to take any parts of this and incorporate into your own thing, you can. If we do the bonus session on Sunday, which it sounds like you guys want it, we'll actually take a practice EKG and go through all 10 steps slowly so that you guys can really understand the 10-step system. But here is our little 10-step program. So first things first, we talked about big sick versus little sick, I think on night 1, and some of you are like, what is that? Well, big sick is a patient who is like, pale, cold, diaphoretic, they're asystole, they're VTAC, they're VF, the big sick. Little sick is anything that's not that. And then when you have little sick, you can go ahead and do the rest. If you have big sick, you're not doing the rest. If you have a STEMI, you better not be doing all of this stuff. You better be doing right to your ST segments, solving for STEMI and taking care of business, right? So, and that's what I see with students that I do one-on-one coaching with sometimes, is I'll give them an EKG and they'll be like, they'll just get like stuck in the weeds and they miss the forest for the trees. And they'll be like looking over here at the T wave. Oh my God, that T wave, it's biphasic or whatever cool thing they saw. But then they miss the STEMI. And I'm like, okay, that's great. You caught that P wave, but your patient is dead, right? So yeah, KJ, yeah, for this purpose, it's okay. So at the end of the day, this is what you're looking at. So rate rhythm intervals is next. Axis is part of intervals, but ST segments is next. Making sure you go from the TP, looking for elevation or depression, and then hypertrophy, looking for the big ventricle, looking at the voltage, not too small, not too tall. I feel like that's a Goldilocks thing. Analyzing your T waves. There's a lot of things to analyze them for. We went over a little bit of it on night 1, but essentially you have to see if they're too big, too small. How are they shaped? And all of that leads to electrolyte stuff, and that leads to like ischemia stuff, right? And then looking at Q waves, are they present? Are they wide, the QRSs? And then finally, there's something called the chief complaint-based approach. So I'll talk about that a little bit more. I have some special glasses I'll wear for you to show you on our Sunday bonus session. But in the meantime, just know this is the system that we kind of use. We're going to go over this again in our 10-step or our breakout session in just a few. So we're at the time. So Ruben, hopefully you are watching this and you can send us to breakouts. breakouts. So guys, we're going to go to breakouts. And so Ruben will move us into the breakouts, and then we will actually come back to the main session so I can announce the scholarship winner. And then we'll go over a little bit more. So hopefully we all get into our breakouts.
How long, Jen, in the breakout?
I think we're going to do like 20 minutes.
Okay, got it.
Yeah. Okay, so welcome back, everybody. So how did it go in your session, Michelle?
I thought it went pretty good. I never get through all the slides.
That's okay.
But we did the reciprocal and contiguous leads. We did all of the we did each one of the leads, like lateral leads, anterior leads, and inferior leads. We got through all of that. We did my little camera thing. I got to show my little heart.
Nice. Yes, Michelle has all the props.
And we re-emphasized the TP segment.
Okay, good. All right. That was really helpful. What's your biggest takeaway? Type in the chat what your biggest takeaway was after tonight, and ask my group, but I'd love to hear the biggest takeaway. So we actually covered a lot of ground in this hour, and I know that it was really fun for us to interact with you guys. I mean, I know we haven't met a lot of you before, and it was just super fun. So type in the chat what your take home is so we know, and we're going to talk about the take home points in the meantime that I want to make sure you leave with. So don't trust the EKG read. I think you guys are like, yeah, I already know that, Jen, right? Always looking for the PQRST, making sure the family's holding hands, know your intervals, right? And then always looking at that TP as well. So that's a really, really important thing. So KJ says, learn new things between hospital and pre-hospital. That's always the goal. Vergata, take time to really review. Yeah, these are good. The 10 steps, loves the pails tip. Yeah, so Michelle and I do a little bit of different stuff in the session, which is kind of fun. Depending on where you go, you get a little different flavor, but that's the great thing is hopefully you guys, some of you got to see both of us, one person last night and then the different person tonight. But now we're going to talk about the most important topic of the night, the giveaway. Okay, so I've been waiting like all 3 days to do this, but I want to announce our scholarship winner. Before I do, I just want to mention that the scholarship winner, what we were looking for was someone that would embody helping the other students. So even if you didn't win the scholarship, we were watching all the great interaction in the chats, you guys helping each other and encouraging each other. I love that. Like, I can't even thank you enough for that. This is a big group and we love encouraging you guys. So future class, start with each lead reading separately. I have honestly never known that as an NP. Yeah, Taylor. So here's the problem is that I just feel like our training are inadequate. And if you're wondering, guys, why would we come? Michelle and I, like I worked all day every day this week, right? Why would we come on a night when we could be free watching TikTok or something, right? Like, because we care about giving back to the community. We want to strengthen you. Your wins are our wins. The hashtag is save all the lives, right? So anyway, our scholarship winner tonight is actually, let's go ahead and just announce our scholarship winner. Actually, I don't think I put the slide in, but our scholarship winner is going to win all of this. Okay. And I'll tell you about this, but our scholarship winner is KJ. So KJ, congratulations to you. Big congratulations. Yay. So KJ, we appreciated you encouraging your other students. We appreciated you trying to help. Even if you didn't know the answer, you still tried to help. And that's exactly what we look for. So KJ, you're going to win a free scholarship to our 30-day EKG challenge, which starts on Monday, 5:30 PST. We'll do our welcome call and you'll be there, KJ. But if you are not KJ and you did not win, you guys can stick around and we can tell you all the things that you get access to. So KJ, you definitely have to stick around to see what you get access to. So anyway, this is the 30-day EKG challenge. So basically, Michelle and I are in this group together in the 30-day. We spend time going over all the basics and repeating them for you. We go very slowly. We didn't have a lot of time in this free challenge, right? Because we actually spent a lot of time, if you think about it, 3 hours, but it's just scratching the surface. So we do EKG terminology. We do hands-on sessions. We send you an EKG kit. I think I already sent mine out for our winner, but I have all the EKG kits ready to go. For those of you that sign up, remember you're going to get the workbook You're going to get the painting, the tools, right? You're going to get the RCAT window tool, and you're going to get crayons so we can do our color coding together, our exercises. But here's the schedule that I've been dying to show you guys. I know, KJ, you shouldn't be surprised because you really went out of your way for other students. So you better continue that in our 30-day challenge, because that's how we all are. We all help each other. So just a little background. Okay, so we started this challenge because every 30 days, roughly, we do another one. And we start with the basic terms, then we go into a practice basic arrhythmias, and then practice with Michelle. And we do this every 30 days. We start, right, for a new cohort, but we also keep the group open all year long. So we have people who've been in for honestly over 2 years now. So we keep sessions going for those folks. So they're always something new. And then we actually have the basics. So every time some new group come in, we have the basics. So everybody can kind of start over together. So it's a whole new class. So our official 30-day starts Monday, the 27th, which is February. So it's next Monday. So we do a welcome, we show you around, we basically do terminology, but then if you want to join, you can join any session you want, and you can join all the recordings from the past, right? But we're going to do an antiarrhythmics lecture. This is for our folks that have been in for a long time, but you can join it, right? You can check it out. But for our basic cohort, we've got the EKG terms, and then we've got basic rhythms. And then Michelle does, if you were in Michelle's session and saw her cameras and her phone, she does a whole hour-and-a-half session here, basic 12 leads. Okay, she goes really, really deep on that with you guys, so you have a good understanding. And then later in the month, she does a practice session in 2 weeks from then, so you can practice it with her on Zoom like we did tonight. You can have your Michelle fix. Now, the other thing we have is David, our Mandalorian. He does a custom study hall every 2 weeks, where he's our paramedic, but he's the smartest EKG brain of them all. And he will basically take your EKGs and that you send in, and he'll break them down for you on the chat, right? So he'll draw them, he'll say, this is why it was this is why it was this. So when you come to study hall, if your EKG is on there, you get to hear, but of course, if it's not, he says, what topics do you guys want this week? And he customizes the lecture. So that's kind of fun. Then Michelle's going to do, I think, Michelle, are you the 13th or the 8th? Do I have you on twice? I think you're on mute, Michelle, but
There, I'm not off mute. Yes, we're doing a basic review. You had asked for a separate one and the basic class. So there's 2 separate ones.
Perfect. Yeah. So actually, we normally don't have this many practice sessions with Michelle. So we're lucky. We have 3 this month. We have the 8th, 15th, and 22nd. So this is like a really, this is the first time we've done so much basic content in the 30-day. We usually kind of like amp up pretty quickly, but I think I had a method to my madness, Michelle. I was like, we need lots of Michelle. And then Gary, who you saw last night, he comes on, he does a 12 lead intro, and he's going to do basically all like he did before, but 12 leads. So if you guys were interested in his basic stuff, he does a really, really good, we call it the 12 lead movie. Now, we also have some special sessions this month. We have somebody coming in to talk about where you can localize PVCs. That's, of course, for our long-term members, but you guys, you can obviously sit in if you want to. And then everything's recorded except for the blue one. So Gary's sessions, he doesn't allow recording, unfortunately, but everything else is recorded and stored. So even if you want to watch it later, you can. Now on the 19th, the box I send you with all the workbooks in it and the crayons, we actually bring those out on the 19th and we go over them together. And we basically get you comfortable with all those high risk things I was telling you about. That's where we do this here. So Ruben's dropping the link for you guys. So is Tori. If you guys want to join us, you can see the link there. Also, we have a cardio NP. Her name is Megan Walls, and she pops in and talks about content that you want to see. Like, for example, people have said, hey, Megan, will you go over stress tests? Hey, Megan, will you talk about beta blockers? Will you talk about how to read a Holter? Will you talk about how to answer triage messages? Like, Megan just customizes whatever, because she does inpatient and outpatient cardiology. So she's got all the things. And then we have more David. Then we have some other specialists that come in. We have Carissa, who's our sleep NP, and she does like tons of sessions. She did pulmonary hypertension for us. She does sleep apnea. She's got all the talks. They're already recorded, but you can ask her questions live in her sessions as well. And then we have a very special session. Whitney every month comes on. She's a nurse practitioner who works in Florida, and she talks about lipids. So she comes on and does her lipid session, and she does cases. And in April, you guys will still be in with us. She's doing a special session on April 2nd, all about LP(a), which is the hottest new topic in lipids. And it's a really important thing to be on the radar. And we don't even add it in our normal lipid panel. So she's going to talk about that in April. So you guys get access to that. But of course, she's going to go over the basics on this day. Now, I'm going to do a session called Study Hall where I go over how to do differentials, how to write a solid note medical legally. We're going to talk about the chief complaints and how to work them up that are chest pain, shortness of breath, syncope, how to really work those up and what to do. And then I'm going to do my cardiac farm lecture on the 29th. So excited about that, where I talk about all the new agents, but I also visit hypertension. So I talk about all the antihypertensives and how to kind of look at hypertension and how to treat it, even in the clinic. And then I talk about like some of the new heart failure meds, some of the new lipid meds, just to give you an idea of what's out there. And when you might see them, what do you do with that? Or how do you prescribe them? So I do that all in under an hour, and it's so much fun. So then we go into April, May, all the rest of the months, and we change our content all the time, but what we keep the same. So let's say like you join now and you're like, you missed the basic rhythms. That is an every 30-day thing. My welcome call, every 30-day thing. Michelle's basics, every 30 days. Michelle's practice session, every 30-day session, right? So there's some basic core classes and then the workshop, but the rest of the stuff kind of changes. So like, even if you hang out with us for a while, you get to do new things. Now the hands-on workshop, this is me and Michelle in San Antonio. We had a really big EKG, this was so much fun. We do all this together in our workshop that's on the March 19th, but again, that's recorded. So if you miss it, you can go next month or you can watch the recording. So that's the really cool thing. And we go over all this stuff in our workshop. So we also we've been doing this 30 days for like over 2 years now, I think. We have all these different bonus sessions. I mean, this is not even an eighth of the list. Okay, so like you could do our med math class, you could do stress test class, you could anything you want that's recorded, you could watch it. And those are all included in your membership that you would be in for 6 months with us. We also, send the painting. We have all the EKG courses, that are recorded, plus the future live stuff, the EKG kit that's sent to you, and of course the workbook and the crayons. So this is a really, really bunch of value, but basically KJ gets it all for free. So congratulations, KJ. But if you are not KJ and you still want to join us and you're like, hey, you know what, Jen and Michelle, I kind of dig the way you teach. You're kind of non-threatening. I've been looking for this for a while. You can absolutely come on. So it looks like Rhonda said, can I join the next one? I'm not sure, Rhonda, what you meant by the next one. But yeah, well, you can join anytime you want. It just changes all the time. And you might not get to see something live that you want to see live if you don't join this time. And then the price is going to go up. So that's also a consideration. So if you want to join us, you can go to the link in the chat, or you can go to conqueringcardiology.com and you can join us. Now, here's the thing. A lot of people ask me after the session, so I'm going to answer just a couple questions for you guys. People ask me, okay, Jen, how do I join at like the most economic rate? I don't have a lot of funds right now, but I really want to join you guys. If that's you, you can join for $127 as a student and get all the same presents in the mail and get all the same access. You just don't get CE. But if you're RN or EMS or PRNP that wants CE, then you just join at whatever rate, right? You just click your box and it'll take you there. So I think that's like the most frequent question. And then the question is like, well, what do I have to go to everything live? No, you can pick and choose. The only thing, if you do CE, we have Veronica, it's 6 months that you get. And then we actually offer you an opportunity to stay on for as long as you want. Like we've had people, we do a yearly membership after that because people are like, yeah, I want to stick around. And that's it's less than what you pay initially, but you get access to everything if you stay on as a year-long member. But basically for the CE, we offer 12 hours of CE. Actually, I think I had a slide on that. Let me show you that. We offer 12 hours of CE. They're all here, the little content pieces that are in your learning portal. So this you'll have access to lifetime. So when you get in, you'll get instant access to this. We'll get you access to the Facebook group. The Facebook group, you get in for 6 months with us. Of course, you can extend as long as you want. We never want you to go. Obviously, we want to keep it interesting for you. But you got the 12 hours that's in here, and you also get a 14-day EKG challenge as part of your learning portal. That's the CE is based on. So once you finish those lectures, you submit your CE, we get it back to you, and you're good to go. So we always post, that's another thing, we post every week what's coming up for the week. So like, for example, you can see our welcome terminology call is the 27th at 5:30. And then we have these two basic, these classes are for our like long-term members, but you guys can go to them. So we post every week, hey, what's coming up? So you can plan your week, and you can also watch the recording, obviously. That's a given. So what do you get when you sign up? You get 6-month access to our Facebook group. You get all the guest speakers. We have so many guest content speakers. You get weekly lives, as you see. We have lots of lives. You can go to all of them, none of them. You get your welcome kit mailed. I put that in the mail, 2-day mail to you. You don't need it till the 19th. So even if you're like, I don't want to join until next week, because we have a lot of procrastinators, that's okay. Join next week. That's fine. We'll still get your kit in time to do the 19th when we do the hands-on session. You get the hands-on workshop, as I said, study halls. So this is like a super good deal. So does anybody have questions for us in regards to any of this? I think the links are there.
You have one question about CE as a cardiac sonographer.
Oh, good question. Yeah, we don't have CEs for sonographers. So we have CE for EMS, RN, and PPA. So if you want to join as a sonographer, join at the student rate, which is the most economic anyway. But it's fun because you actually get access to like Megan's interpretation of echoes. She does like 3 or 4 sessions on that. So that would be fun for you as a sonographer. Good question. Okay, cool. So just to clarify, the cost of the 30-day EKG is good for a full year. So actually, you get 6 months access in our Facebook group, Joanne, right? But Joanne, you were a previous member. So we've communicated offline. As a previous member, you get the discount of the old member. So you actually do get a full year, but everybody else who joins, right? You first join, you get 6 months, and then you get an offer to extend for as long as you want. We do a year at a time. Yeah. So how long does my membership last? Again, that was a 6-month, but you can renew. So I think that's the biggest question that people have. So Conquering Cardiology, do we get to stay in this group? Yeah, another good question, Taylor. This is our 3-day EKG group. This is our free group. And yes, you can stay in here. Absolutely. We do live classes usually once every 6 weeks in here, but they're usually the same. So Taylor, if you're like, yeah, I kind of want to like go deeper with you guys and I don't want to keep doing the same class over and over again, then you come into our 30-day. But if you're like, yeah, I just want to hang out with you guys, because we have like, I will say we have 16,700 people in this group right now in our free group. But I will tell you that there are a lot of names that I see come every time with us. And it's so fun because that means that we're doing something right. And we love that. And even if you don't join the 30-day, we love seeing you around. And I do get to know your names. I can say them all right now, but what's the point? But there's a lot of new folks on here, which is exciting this time because, but let's see who's on here. So like, Kate Webb, I think this may be your first time. Joy, this is your first time. Heather, I haven't seen you around before either. Heather's. Ash, I think you've been here at least once. Jean, I think you're new. Trishula, you're definitely new. And I love seeing your face. And yeah, Joanne, you're a repeat customer. So we know your names. We see you. We love hanging out with you guys. But yeah, we're here, like I said, every usually 6 weeks. And sometimes we do bonus events in between. So however you want to stay in touch with us, stay in touch. But KJ, message me so I can get you your link to the group and get your address so I can mail your kit. So congratulations. And Michelle, do you have any final thoughts for everybody? This was so fun. Yeah,
this was a lot of fun. We had a great time in our group. Are you going to do the one on Saturday? I'm going
to do Sunday. 5:30. I'll do a bonus session on the 10 steps. So we'll take an EKG, one EKG. We'll go through it 10 steps at a time, or each step at a time, kind of slower, so we can practice that. So yeah, that'll be recorded as well. So in case you have plans Sunday, don't worry, we'll record it for you, no problem.
Okay, and we'll do the mug rugs on Sunday then.
Do you want to give a hashtag to people they have to put in now?
We can. We want to do that.
Let's do that, and then you can announce the winners.
Okay, we want to do hashtag zebra.
Okay.
Since I've got little zebras with super cute little zebra backs.
Oh my gosh, adorable.
And this one's really cute too. I like this one. That's one of my favorite back ones, but this is the front. And if anybody's a paramedic, I have two that are paramedics that have dogs and cats that I still haven't given away to anybody. There's a little, someone called for a paramedic. I think there's a kitty cat here too. Yeah, there's a paramedic in this one too.
So Joanne is actually one of Marla's friends. So I know you probably appreciate that. These definitely Joanne, right? And so yeah, it looks like we got a lot of hashtag zebras. I'll get you those names, Michelle, so you can draw and announce them on Sunday. Okay, guys.
Perfect.
Have a good night. If you're too shy to ask questions, just send me a message in Facebook Messenger. And then Tori's giving us the link. So thank you guys for being here tonight. Oh my gosh, so much fun. Have a good evening. Bye.
Thanks, guys. Bye.
Bye.